Partial agonist. A partial agonist binds to the same receptor site as a full agonist, but produces a weaker effect, even at full receptor occupancy. It has lower efficacy than a full agonist. However, it can still activate the receptor to some degree. If given with a full agonist, it can block the full agonist's effect by competing for the same site, acting like a functional antagonist. Example: morphine is a full agonist at the mu-opioid receptor. Buprenorphine is a partial agonist. It activates the same receptor but produces a smaller response. USMLE Question 1. A patient with opioid use disorder is transitioned from morphine to buprenorphine. Despite occupying the same receptor, buprenorphine produces less euphoria and respiratory depression. What best describes buprenorphine's receptor activity? A. Full agonist. B. Non-competitive antagonist. C. Competitive antagonist. D. Partial agonist. E. Inverse agonist. Correct answer. D. Partial agonist. Explanation: buprenorphine binds to the same opioid receptor as morphine, but produces a weaker response, typical of a partial agonist. Why not the others? A. Full agonists like morphine produce a full response, which buprenorphine does not. B. Non-competitive antagonists reduce efficacy but do not activate the receptor. C. Competitive antagonists block the receptor without any activation. E. Inverse agonists reduce baseline receptor activity, which is not the case here. USMLE Question 2. Which of the following best explains why buprenorphine can both activate opioid receptors and reduce the effect of morphine if given together? A. Buprenorphine is a competitive antagonist. B. Buprenorphine is an inverse agonist. C. Buprenorphine is a non-competitive inhibitor. D. Buprenorphine is a partial agonist. E. Buprenorphine is a physiologic antagonist. Correct answer. D. Buprenorphine is a partial agonist. Explanation: as a partial agonist, buprenorphine binds the same receptor as morphine and partially activates it. When both drugs are present, buprenorphine blocks morphine's full effect, acting like a functional antagonist. Why not the others? A. Competitive antagonists block but do not activate receptors. B. Inverse agonists reduce receptor activity below the baseline. C. Non-competitive inhibitors affect different sites and reduce efficacy permanently. E. Physiologic antagonists work on different systems or receptors.